Hi everyone, welcome to your Pharmacy Career Planning 1 course. This is your week 6 and 7 presentation because it covers chapter 12, which is for both weeks. So this chapter is all about hospice pharmacy. So the first part of the chapter deals with an overview of exactly what is hospice to begin with before we get into what is hospice pharmacy. So it's really important to understand what is hospice and how we fit into that piece of the puzzle. So the idea behind hospice is that we are working with a patient who is terminal. So this patient has a terminal illness of some sort, and we're not only working with the patient and their illness, but their family as well. So they're all part of the treatment. So we're not just treating the patient, we're treating the whole family unit. So the other piece of this is not only are we treating the illness, so whatever might be causing this terminal illness, so whether it's cancer, HIV, AIDS, those types of things, but we're also treating their emotional and spiritual well-being as well. So as pharmacists and pharmacy technicians, we're just a small piece of the puzzle. There's a lot of other folks that are part of this group, that are part of this care plan. So that includes obviously the doctors and the nurses, but there's also going to be social workers, dietitians, clergy members, volunteers. A lot of other folks fall into this group of people who are working with our hospice patient. There is something called a care plan that's put in place. As with any other type of home health care, there is going to be an assessment and some sort of plan. So what are we going to do? How are we going to make this patient the most comfortable? So again, the whole idea is behind comfort, providing comfort to that patient and relieving their suffering rather than curing the disease. We know that we're not going to cure them of their cancer. We know that they're in end stages. So it's what can we do to help them manage that. When it comes to the pharmacy piece of hospice care, we're going to dispense the medications and prepare them to help them in their home or in an institution, wherever they happen to be. And these can be, traditional types of medications, but it might also be the drugs for pain relief. And in some cases, depending on where you live, what state you're in and things like that, it may very well be the end of life medications. And by that, I mean medications that the patient might choose to have administered that will intentionally end their life. I can tell you as a child of a patient who was in hospice care, my mother was a hospice patient, and it was in her end stages of breast cancer. And one of the things that she was able to do was to choose to have a certain dosage of morphine for pain that not only relieved her pain, but caused her respirations to stop. And it was considered an end of care type of prescription. So in other words, we had to go in ahead of time. We had to meet with the doctor and pharmacy so that we knew what to expect, so that we knew what to look for, so that we knew what was going to happen. And not only did our mother have to agree to what she wanted to have done, but as her children, my sister and I did as well. So our entire family was there. We were all part of the plan. We knew what was expected, and we knew when she made that decision what was expected of us, because we were also had a responsibility. As the oldest daughter, I actually had to sign papers saying that I understood what was going to happen when that drug was administered. So keep that in mind, that there's a lot more to hospice pharmacy than just giving a med every now and then. This hospice pharmacy can be a traditional pharmacy, so you might be getting the meds from your, local pharmacy, might be supplying it just like with any other home health care situation, or it might be strictly for hospice patients. So any of those are possible. You're going to obviously have some of the other same kind of elements in a hospice pharmacy that you would have in a regular pharmacy. You're going to have a pharmacist, pharmacy technician. Since this is going to be sent to that patient, you're also going to have delivery services, other types of support personnel, billing, that type of thing. The inventory for hospice patients is typically somewhat limited. Many times it's strictly the things for pain control and symptom relief. The design of the pharmacy does resemble a traditional pharmacy, but in most cases you are going to have clean rooms because a lot of these medications are going to be IV infused. Keep in mind that depending on what stage the patient's in, they may be non-responsive at a certain point, so they're not going to be able to take pills and things like that. Of course, there's going to be equipment just like there would be in a regular pharmacy. We're going to have delivery. And obviously, promptness is very key when you're talking about dealing with hospice pharmacy. So again, a lot of pain management and symptom management when we're dealing with hospice pharmacy. So we're going to be looking at 24-hour coverage, wanting to make sure that that patient has our help at all times. Specialized compounding, administered through non-traditional routes. Another example might be, again, pain relief is a big one. So that could be something for, that might be administered through an IV, a patch, rectally. Those are all things that might happen. The starter kit that they talk about is something that's provided at the start of a hospice treatment. And these are just some of the many things that are included. Morphine, obviously, for pain. Some of these drugs are also for anxiety type symptoms. We have things like diphenhydramine, which is for not only for an antihistamine, itching and things like that, but it's also used for sleep. Chlorprenzine is used for nausea. And then we have things over here on this side that are, Senna and Bisacodyl that are used for things like constipation, because a lot of the drugs that are used for pain relief also have constipation issues along with them. There is legislation that is involved with hospice pharmacy. These are just some of the many different types of legislation that's included. A lot of different ones. Probably the most important is knowing what the regulations are in your state. So if you do have a job in hospice pharmacy, you'll want to make sure you're familiar with your state regulations. And then, of course, what's our role? It is definitely an unusual role. And a lot of it has to do with communication. How do we communicate with the patient and their family? And then, of course, things about, caring, being able to listen, and then the technical skills, being able to do compounding and things like that. You're going to have to attend team meetings and be part of that group with, who decides how do we care for this particular patient. And then there's always the administrative role. So, the actual, how do you, hiring and firing, and how do you use the equipment and things like that. As far as the pharmacy technician goes, you're going to have a kind of a combination of things that you do, whether it's retail types of activities that you may be more familiar with, and then home infusion. So putting together the compounds, things like that. So knowing about how hospice works, how those infusion therapies work, are all going to be part of understanding that role. Again, knowing how to do calculations is going to be very important, and communication, because again, being able to communicate with the patient, especially if you're the delivery person, and being able to explain to them what they're getting and how to use it and things like that. So as you go through this week and next week's presentations, if you have any problems or questions, please make sure that you reach out to me, and have a great next 2 weeks. Thanks.